Did you know that psoriasis is a chronic skin condition that affects 2 to 3% of the population? People with psoriasis have an increased risk of also developing psoriatic arthritis. As a result, they are often treated by both dermatologists and rheumatologists. So are you fed up with your psoriasis? The Toronto Western Hospital, in partnership with the University of Toronto, Canadian Association of Psoriasis Patients, Leo Pharma, and CIHR-IMHA, is proud to present the study on Do Psoriasis Patients who participate in clinical research differ from those who do not? The goal of the study was to confirm that what we have learned from patients in our clinical research program can be applied to all patients with psoriasis. In 2006, the divisions of rheumatology and dermatology at the Toronto Western Hospital established a cohort of patients with psoriasis who did not have psoriatic arthritis, which we'll refer to as the University of Toronto Psoriasis Cohort. These patients participate in clinical research in our psoriatic disease program, attending annual follow-up at the Toronto Western Hospital. We also follow and treat many patients with psoriasis who do not participate in clinical research. The study began by developing a data retrieval form, which collected information on pertinent areas to compare between those in the research cohort and those who do not participate in research. Some of these areas included age, gender, age of diagnosis, employment, family history, smoking, alcohol consumption, as well as diseases associated with psoriasis, such as high blood pressure, diabetes, and the medications used to treat the psoriasis. We reviewed the charts of patients who were not enrolled in clinical research and collected the pertinent information. The information was then compared to the patients participating in the University of Toronto Psoriasis Cohort. The data from each group of patients was statistically analyzed to determine if the two groups are similar. Based on our analysis, the patient characteristics were shown to be very similar for the majority of the variables between the University of Toronto Psoriasis Cohort and the group of patients who do not participate in research. Likewise, the associated diseases that both groups developed were very similar. Based on our preliminary results, it appears that the two groups are similar, and it may be possible to generalize the information that we have learned from studying the patients in the University of Toronto Psoriasis Cohort and apply it to all patients with psoriasis. With your ongoing support for psoriasis research, we can improve the treatment plans and daily lives of people with psoriasis.